experts will explain concepts in basic science.
Bear in mind that basic research does not have to be basic in the simplest sense of the word. It is something that we want you all to redefine to make it more attuned and relevant to the needs of our time.
What vaccine brand is appropriate for them. So anyone from our experts?
With the vaccines, it depends how long we get. So, for example, I'm trying to avoid naming brands. So, kagaya na sabi kanina ni Dr. TUAZON, parang ang hirap magsalita on ano. Pero just to tell you, to give a point, no, if a certain brand is effective for the mother or the original variant, for example, it might not be effective dun sa mutations. So, what is effective right now might not be effective the next time. Okay? Because, number one, viruses are designed to mutate. So, it's nothing new. So, it doesn't even alarm me because if a virus doesn't mutate, an RNA virus doesn't mutate, it actually alarms me. It alarms the virologist. Okay? If it doesn't mutate. That's number one. So, the next would be, yung pressure. Right now, I think the vaccination rates are lower than expected. We haven't reached the certain level of vaccination that we would want. And this might induce pressure on the virus because the transmission is very, very high. So I always say in my lectures, the viruses are designed to survive. As they're not, we won't consider them organisms, no. But like us as a species, no, we all want to survive. So survival of the fittest. So what happens is, if you have incomplete vaccinations, no, lower yung vaccination rates natin, what happened would be it pushes the virus to mutate, no, and to escape vaccination. So now your preferred brand of vaccine is not effective. So you'll realize after some time na sana pala nagpa-vaccine na lang ako, right? Kasi it's not, I would tell the people, no, with my lectures, no, it's not a matter of if, it's a matter of when you get infected. Okay? So, laging ganun yung isipin natin. So, the emergency use authorization tells us that the vaccines are safe. Okay? So, regardless of the brand, yun yung point natin. For the effectiveness, we have studies right now and the guidelines change. Okay? At the policy standpoint, it means that they're hindi magulo, no? That people would tell us, ang gulo kasi ng policy. No. That is actually reactive to science. No? That is reacting to science, reacting to the best data available as of the moment. Because as we speak, even the best experts are deliberating. So what we have said today might change tomorrow. So that's my general answer to that. Thank you.
Thank you, Dr. ULANDAY.
Leslie, can I add to that?
Yes,
I
please.
kept nodding my head off. I'm sure Dr. ULANDAY would see. The good news today is that we have more vaccine supplies. Okay, so this month has been extraordinarily, in terms of the vaccination, the scope of vaccinating people has been much faster in this month. And we're anticipating, if everything goes well, we're anticipating more supplies to come, and particularly on the last quarter. So this is the time that all the panelists kept saying, not which one, but when. So please take advantage of the vaccine supplies that are currently going out. They're actually, as they said, there's no need to choose your vaccine. The other is, and this might increase our confidence in vaccination, even the brand that we thought most people did not like performed much better in real world. So even if the vaccine efficacy was relatively low compared to the other vaccines, actually it performed better than what we expected. So all the vaccines work. But we really need to get vaccinated as soon as possible. Thank you.
Thank you for that information, Dr. TUAZON. Thank you for that information. It's certain. So after recovering from COVID-19, when can they get vaccinated?
So my answer to that, Prof. Les, is once a person who tested positive, and maybe with some symptoms, once the person has finished the required number of days recommended in the by the by the country, right? Kasi iba-iba yung guidelines. Once natapos na yung isolation period and wala nang symptoms yung person, you can actually get vaccinated. You don't have to wait for 6 months. Kasi initially, there was a guidance saying na you have to wait for 6 months kasi you have some antibodies and you don't need to get the vaccine. That is actually true. You can wait. But I would not recommend that kasi nga sinabi ng lahat ng panelists na it's a matter of time. And we've seen that even if you had COVID before, you can be reinfected. And there was a study that was recently published in the MMWR of CDC showing that at least a third of people in that study na infected and positive RT-PCR positive, they had no antibodies. So getting infected or getting PCR positive test sa COVID doesn't necessarily mean that you have antibodies. So I would say once you finish the isolation and you have no symptoms, get the vaccine.
Thank you, Dr. SENICAS. Would you have something to add, Dr. Velasco, or shall we go to the next question? Okay. So there are also questions about herd immunity, and Dr. SENICAS is being requested to comment on the constraints of herd immunity.
Constraints of herd immunity. So siguro maybe to step back a bit. Kasi di ba before we had vaccines, ang daming talk about herd immunity, sinasabi na 60-70%, and parang naging obsessed tayo with that number. No, na parang, we have to reach 70%. But actually, what we're seeing in the real world situation is there are countries who have controlled COVID even without reaching this specific number yet, right? We've seen it in Iceland, Denmark before they reach the level they have now, New Zealand, of course. So I think we should not be obsessed with this number, but really vaccinate as many people as possible. Kasi it's really a race between vaccinating these people and the variants emerging. And as mentioned earlier, if there are more people na not vaccinated, they are technically gonna be like incubators for virus mutations and potential new variants. And you also heard probably na sinasabi ngayon that the herd immunity threshold is now higher, diba, like 80 or 90%. But again, wala pang country in the world that has reached 90% of fully vaccinated individuals, but we are seeing many countries that have controlled the outbreak na. So what I'm saying is maybe we should forget about a specific number. Just really continue with the public health and social measures and vaccinate as many people as possible.
Okay. Thank you, Dr. SENICAS. So that's the message. We have to vaccinate as many people as possible. Let us not be obsessed with that number, with a number for herd immunity, because there are other countries who have been successful in combating COVID even without herd immunity yet. Okay.
Introducing Health Insight Wellness. Healthy Blend 15-in-1 and 16-in-1 coffee blend